a 32-year-old male here for really just pain in the left hamstring. He was running like 4 or 5 days ago without stretching, just kind of ran a sprint and felt a pop in the left hamstring. He's really just tender right over the proximal kind of lateral hamstring region. So we're going to go ahead and just do an ultrasound, just looking for any kind of tear in the muscle. I don't think it's really where the conjoint tendon is, or where the semimembranosus tendon is on the ischial tuberosity. He doesn't seem so tender over there. So I'm just going to go ahead and do an ultrasound. Here we're focusing on the posterior thigh. Here we can see the biceps femoris long head and short head muscles. And now we're rotating. We can appreciate the semitendinosus muscle that was just removed, and you can see the underlying semimembranosus muscle. Now the biceps femoris was removed, and you can see the sciatic nerve. Here the biceps femoris was brought back, and now we're going proximal. You can see the small hematoma in the proximal aspect of the biceps femoris muscle, on the intermedial aspect of the muscle, just near the distal conjoint tendon. Here we are now, we're looking at the ischial tuberosity in an axial plane. Lateral is to the left. You can see the semimembranosus tendon, which is more lateral and deep to the conjoint tendon, which is more posterior and superficial to the semimembranosus tendon. We're going to go distally now. Here we're getting that Mercedes-Benz sign in view. You can see the sciatic nerve to the left, which is lateral, and you got the semimembranosus tendon, which is just medial to that. And at the apex of this sign is the conjoint tendon. Here it's a little clearer. We can see the conjoint tendon a little bit more discrete. You can appreciate the muscle layer with the adductor magnus muscle as the bottommost layer here that's underneath this Mercedes-Benz sign. And here as we go distally, you can appreciate the conjoint tendon getting somewhat more narrower and more vertical in orientation. Here you can appreciate that honeycomb texture of the sciatic nerve. It's a fairly large structure. And you can appreciate the kind of oblong shape of the conjoint tendon. So a little bit of hypoechoic signal around the conjoint tendon. This is where he's tender. Is that tender right here? You can appreciate some black anechoic signal in the biceps femoris muscle, essentially abutting that distal conjoint tendon.
Yeah, maybe a little bit further down, a little further left is what I'm thinking.
Plus this correlates very well with his symptoms, so it kind of hones you in on the pathology. Here again you can appreciate some of that dark signal just abutting the biceps femoris long head tendon, probably just distal to the conjoint tendon. But a little bit of dark signal, kind of more lateral to it. Again, you can appreciate that dark anechoic signal, pretty subtle, and again the fact that the patient's tender there kind of like hones your attention into that area. I'll focus now a little bit on the semitendinosus muscle. So here we're at 1405, semitendinosus muscle. Here we're just looking at semitendinosus muscle. You can appreciate that swervy kind of central raphe within the muscle itself. Now we're going distally. You can appreciate the semitendinosus muscle beginning to fade out and essentially forming a tendon over the semimembranosus muscle. So now the semitendinosus muscle is turning into a tendon as you go distal. So let's look at this now in a long axis view. Right side is going to be distal. So now we're looking at the conjoint tendon in a long axis view, as well as the semimembranosus tendon just underneath that. You can see it here, just kind of feeding into the... You really have to heel toe your probe in order to get these tendons in view, as they're quite deep. You can appreciate the gluteus maximus muscle overlying the ischial tuberosity. Now we're going distally. You can appreciate the sciatic nerve in a long axis view just underneath the biceps femoris muscle. So here's kind of this tender spot. Correct me if I'm wrong, 1409. You can see a little bit of dark signal, kind of the belly of the muscle at the bottom. Again, not so obvious, but again, it correlates well with the patient's symptoms. So this, I believe, is the grade 2 muscle tear of the biceps femoris muscle. Here's an interesting view of the adductor magnus feeding into the femur and kind of where the biceps femoris short head muscle begins. And here again is the muscle tear. Here's the sciatic nerve again. So you can really use ultrasound to kind of pinpoint where this tear is. It's at the proximal medial anterior aspect of the biceps femoris long head, just above the sciatic nerve, essentially.
A
little bit of dark signal, but I don't think that's it. And 1410, now we're going to go a little bit lateral. Nothing over here, right?
No.
Okay, but that's it.
That's it. Yeah.
Yeah.